Welcome back to Addictopydia, the channel where we break down everything you need to know about addiction, recovery, and mental health in a real, honest, and evidence-based way. Today we're diving deep into a topic that often raises a lot of questions. Medicine as part of treatment for addiction, especially opioid addiction, and how behavioral therapy plays a crucial role in long-term recovery. If you've ever wondered whether taking medications like methadone or buprenorphine means you're not really clean, or how therapy actually helps beyond medication, stay tuned. We're unpacking all of that and more. First, let's clear up one major misconception. Medicine doesn't replace one addiction with another. When used properly under medical supervision, medications like methadone, buprenorphine, naltrexone, or a combination of buprenorphine and naloxone are not about getting high. They're about restoring balance to the brain and body that have been altered by opioid use. Let's take methadone as an example. It's a long-acting opioid medication, but it's used in controlled doses to prevent withdrawal symptoms and cravings. It stabilizes the brain's chemistry, allowing a person to function normally, go to work, and rebuild their life without the dangerous highs and lows of drug abuse. Buprenorphine works a bit differently. It partially activates opioid receptors, which means it reduces cravings and withdrawal without producing the same euphoric effects. And naltrexone works as an opioid blocker. It prevents opioids from binding to receptors, meaning even if someone tries to use, the drug won't have the same effect. These medications are what we call medication-assisted treatment, or MAT. They're often combined with therapy and counseling, which makes them even more effective. Here's the truth. Studies show that people receiving MAT are less likely to relapse, less likely to overdose, and more likely to rebuild healthy, functional lives. However, medicine alone isn't the entire solution. Think of it this way. Medication can stabilize the body, but therapy helps to heal the mind. Addiction isn't just a physical dependence. It's also deeply psychological and behavioral. The reasons people use drugs, trauma, stress, mental health struggles, or environmental triggers don't disappear just because the cravings do. That's where behavioral therapy comes in. It helps you understand why you use, what triggers those urges, and how to change your responses. For instance, cognitive behavioral therapy, CBT, helps people identify destructive thinking patterns and replace them with healthier ones. Say someone believes, "I can't handle stress without drugs." In CBT, the therapist helps them challenge that belief and develop alternative coping skills, like deep breathing, journaling, or calling a support person. There's also motivational interviewing, AMI, a counseling technique that helps strengthen a person's motivation to change by exploring their personal reasons for recovery. And for people with both addiction and mental health disorders, a dual diagnosis, therapy helps address both conditions together, ensuring neither is ignored. Behavioral therapy isn't one size fits all. Depending on the program, it might happen one-on-one, in a group, or with family. A therapist or counselor might help you develop personalized coping strategies for cravings, learn relapse prevention tools, manage stress without turning to substances, deal with relationship issues or legal challenges, rebuild communication with loved ones, and address other mental health concerns like depression or anxiety. Let's take an example. Maria, a 32-year-old recovering from opioid addiction. She was prescribed buprenorphine to manage her cravings. But what truly transformed her recovery was therapy. In her sessions, she learned that her substance use was tied to unresolved trauma from her teenage years. Over time, her therapist guided her through emotional healing, helped her rebuild her confidence, and taught her new coping skills. Medication gave her stability, but therapy gave her freedom. That's why experts always emphasize a holistic approach, combining medication, counseling, social support, and lifestyle change. Another key part of treatment success is family involvement. When family members are educated about addiction and recovery, they can provide better emotional support instead of judgment. Therapists often bring families into sessions to help improve communication, set healthy boundaries, and repair broken trust. When loved ones understand that addiction is a medical condition, not a moral failure, it reduces shame and builds a stronger recovery environment. To sum it up, recovery is not just about stopping drug use. It's about healing the body, the mind, and the relationships around you. Medication can help manage cravings and prevent relapse, but therapy helps you rebuild your life from the inside out. If you or someone you know is struggling, remember, asking for help isn't a sign of weakness. It's a step toward freedom. Don't forget to like, share, and subscribe to Addictopydia for more real talk on addiction and recovery. Together, we can change the way the world sees addiction. One story at a time.